How you doing? I've been
Good. And
a
you?
I've been following this company for I would say when you guys were OHRP and then switched the symbol to NeuBase. I was excited for the technology behind it. I'm a biochem major, so I
All
understand a
right.
little bit about actually a little bit more than normal people in finance about what you guys are doing, and it made me think of alnylam a long time ago when I was buying it at $7.
All right. Wow.
Yeah, and it's kind of similar. It's like pure biotechnology. So I'm here to hear what you guys, how you guys, what the message is, what should I be looking forward to in the future.
Yeah.
Um, you know, I remember Green Einhorn or Green, who was it?
Green light.
Yeah.
Greenlight Capital's in there too.
Yep.
So, and he was there from the
Yeah.
beginning. The stock
Well,
has done really well since when I've bought it. I sold it once before, and I'm looking to buy it back heavier now because I have some good profits in it anyway.
great.
Um,
Great. Well, it's such a pleasure to meet you. And you have a
Absolutely.
very famous last name. Are you related to anyone I might know?
We're not related, believe it or not. We might even look the
Really?
same. I've spoken to his dad. I think we might have a similar bloodline
Be
from back
cool.
in
That'd
Iran.
be
Yes.
cool. Well, no, pleasure to, and thanks for being a shareholder over the long term. We feel like we're just getting started here. And I feel like we're probably at the same stage where you jumped into Alnylam, where we've got a platform that we've now validated, and we're about to start spitting out drugs here in the next 12 to 24 months. And we intend to build a huge company around this platform. So that's the plan. We can talk about specifics of why we believe or timelines or any direction you want to go.
Actually, the direction I pretty much know what you guys are doing, but what makes you guys think that you have a sort of edge in the technology? From because when I was reading about, I had a research report a while ago. I don't remember exactly what it was, but it sounded kind of different. I just wanted to know how, because I understand DNA opens itself, enzymes come on, RNA is made, ribosomes come on, tRNA comes in, makes the protein.
Yeah,
Sometimes there's mutant proteins that you don't want. Um, so you guys stop the process of it creating that.
yeah,
Uh,
yeah, yeah. Okay, so let me put it into context, and you already know this, but it helps me with my flow of getting into why we're different. So I think we're at a really important inflection point in history where before we developed drugs by basically pouring hundreds of thousands of unknown small molecules on targets and hoping some of them stick, and then basically going on a decade-long journey of engineering potency and engineering out off-target engagement. And $2 to $4 billion later, you might get a drug. And now, because we have the sequence of the genome and we have all this compute infrastructure, we can go upstream of those misbehaving proteins and go to the RNA or the DNA and hopefully just put an off switch on the misbehaving gene so it never forms a broken protein and causes disease. So that's conceptually what we do. So we can turn genes off that are misbehaving or turn genes on when we need more of them. And we can do that at any level between the genome and the mRNA. So what makes us special is the scaffold that we use. And the scaffold is completely synthetic, whereas what Alnylam and Ionis use and Moderna use is all keyed off of a natural backbone, sugar phosphate DNA or RNA backbone, and they've tinkered with it to try and stabilize it. But the issues there with those scaffolds are they're not well biodistributed in vivo. They basically go to the liver, kidney. They cause pro-inflammatory issues, liver and kidney damage, and they're not really sort of precise in where they engage. Whereas ours is completely synthetic and biologically inert. It's actually made of and as a biochemist, you probably appreciate this, it's a polyamide scaffold, which is essentially nylon. Totally biologically inert, so it doesn't trigger an immune system, doesn't cause liver or kidney damage until you get to 100 times the effective dose, and that's temporary. Because it's semi-rigid, it will preferentially engage only with perfect sequence matches. So even if there's a single mismatch, it'll pop off. And that dramatically reduces off-target engagement, which is a source of toxicity. And finally, by modifying this backbone with specific chemical moieties, we can give it systemically and it gets everywhere. So we feel like we've sort of engineered out all of the negatives of the first generation precision medicine companies. And by the way, those negatives are going to limit their opportunity space and their upside. I mean, if you can't go past the liver and kidney, you're constrained. If you can't dose chronically across a lifetime because you trigger an immune response, you're constrained. And so by engineering those out, we've sort of significantly, if not completely, opened up the addressable market size.
Pretty fascinating. So now, before I talk about anything, I'm not going to talk a lot about financials because for me, I understand it. I know what the target is. I know how big it could be. So I would like to use this to talk more about the science behind it, if
Okay,
that's okay with you.
of course.
But financials, I see you guys have 35 million cash. I don't know if this is updated. Market cap is 213 million. Enterprise value, when you subtract the cash, 178. You have some holders. Stephen Dietrich is, I don't know who that is.
Hey, that's
you,
major.
right?
Yeah.
All right, so I'm talking to the main shareholder. Greenlight Cap. So how'd you get Greenlight?
Sam, you want to take that one?
Yeah. So Greenlight's an interesting story. We were, introduced to David Einhorn in between the time when we announced the merger and closed the merger, which was a 6-month gap in 2019. And we were just out on the road introducing the story to investors, as you typically would, in a go public process. And he liked the story. He thought it was intriguing. We left the meeting thinking, hey, we piqued David's interest, but that's probably where it ends.
Okay, that sounds good.
And in the background, he, because he's got involvement with the Michael J. Fox Foundation, he had the right scientific experts to diligence this. And in the background, he was working on it. And a couple months later, before we closed the merger, he came back and said, hey, I want to invest. And the pre-merger financing had already been called for months earlier, so we couldn't reopen that round without reopening the whole process. So we said, hey, you want to put in, minimum we'll take is 5, and that's what we did. So we negotiated a deal with him where he put $5 million in directly, and we did that concurrent with the merger. And then he re-upped to remain just slightly below 10%. He took his his pro rata portion of the $36 million financing we just did in April.
Right. I can see. Maybe that's probably why there was some volatility in the stock, I guess.
Yeah. So we put out some data right on the last day of first quarter, March 31st, and that was, the big platform validating data set that that got everybody really excited, both on the investor and the business development front. And we did a financing about a month later. And that was a deal where it was at the height of COVID. Nobody was getting any transactions done. This is before the market heated back up. We went out hoping we'd get $15 to $20 million. Within a very short period of time, we had $130 million of demand. Good fundamental institutions, so none of the fast money players. We ended up upsizing from 15 to 20. We upsized the deal twice and ended up taking in a total of 36. Brought in some good institutional investors. We priced it at 6. Stock never saw the south side of 7, and it's been trading, I think, pretty well since then.
Absolutely. Okay, so that's that. So with this cash that you have on hand, is that something that you guys are just going to keep under your belt for like the next few years to pay for the run rate and the expenses? Or are you looking for acquisitions? Or are you sticking with the two pipelines that you have plus the unknown targets of future? Is that the
Yeah, so
final? Okay.
the focus, so cash runway gets us into first quarter 22. We're focusing our resources on the internal programs and then building out the pipeline behind that. Again, the goal over here, because the platform is so, has such great scale and scope, naturally, we're going to continue to build that out. We think that probably sometime in 2021, hopefully we can get a business development transaction done, and that'll give us the ability to take in pretty significant non-dilutive capital, resource up a handful of additional programs based off of the platform, and then continue to drive off of that.
Right. So let's say you have all the financing that you need forever. What's the time frame from when you guys think you got can be applauded in the street for the science that you have with the nucleotide flexible gene on and off switches?
Yeah, what do you think, Sam?
I mean, I think that, certainly what we've seen in precision genetics companies, I know Dietrich's going to be a lot more aggressive in his answer than mine. I think with what we've seen with precision genetic medicines platform companies is that they get rewarded very early. And I'll just point you to a couple of comps, whether it's Avidity or whether it's Dyne, who are both two recent IPOs that are, they're taking antisense technology or RNAi technology, and they're coupling it to antibodies to, drive into muscle. I mean, that's their sole solution is to just get those molecules into muscle preferentially versus what normal ASOs do, which is, get into the liver and the kidney primarily. Those are companies that are sitting, 900 million to $1.2 billion right now, and they're 12 to 18 months away from the clinic. So, I think that once we get some more data under our belt, even at a preclinical stage, and we continue to go out there and talk to the investment community, that we will get significant credit. Ultimately, our peer groups tell us that once you get into the clinic, you're at least $1 billion company, sometimes $2 billion in terms of value. And then once you validate that, you're looking at, a multiple of 1 to 2x from there, like what you see with Arrowhead, like what you see with Dicerna, even what you see to some extent with Arcturus and others in the space.
That's beautiful. Fantastic. Have any more of the financial questions? That kind of makes sense. Okay. I think if I remember anything about that, I'll let you know. But quickly, again, one more time. When it comes to shutting off genes or turning on genes, this is just a generic question, I guess, at this point. Is that all the body needs for this? And is it like a thing that you're better off doing in the embryonic stage, or can you do it like midway and not midway in life when you're younger? What's the
Yeah,
best time for, you know?
such a great question, and so I think there's a world of complexity, and it's probably keyed off of that every disease is going to have a different sweet spot. So, for example, Huntington's disease. If you're symptomatic, if you get symptomatic and you're diagnosed clinically with Huntington's disease in your mid-50s, you've already had a decade worth of brain cells dying that have finally gotten to the point where you're having major issues. And if you go on drug at that point in time, you might slow or stop the progression, but you're never going to grow those brain cells back. You've already got walking, speech, cognitive deficits, et cetera. So in that instance, what you want to do is get a decade in front of the time when people are usually symptomatic. So in your mid 40s, there's no reason to do it earlier because the neurons haven't died. So in that case, that's pretty clear. There were definitely indications where, for example, and I'll just go to some extremes here. You know, if you've got the mutation, you're dying in utero, right? And so there are, you know, not that we're going there, but you know that you would want to intervene earlier if you're going to intervene at all. And there are instances also where you can intervene at symptom onset and reverse the symptoms. One of our
Is it as simple as the protein is not there, or the protein, too much of this bad one is there, and anytime your body takes a toll, and that's all it is for now? I mean, I look at you guys as like a science company that probably has an edge, and the market will appreciate that, because once we go from pharmaceuticals and trial and error, and there's a few teams out there that you just want to give money to because they might get to the rat race at the end like quicker than everybody else, or even in time, but you're going to make so much money once people recognize who they are. So I look at you guys at such an early stage that it's a good time to invest anyway.
Yeah.
So there's a lot of room right now, and there's a lot of time, and people will be patient as long as it's not going to be like. I mean, I even still there's this liver company, Intercept, that went from like 60 to like 400 because I don't know, it's like fatty liver disease and stuff like that. They
Nah.
had a way of fixing it, but now it turns out that it didn't work, and the stock got cratered from 400 back to 40. And there's still hope maybe that this team of people will figure something out later, or correct that, or do something else, because it's the team of people that you have and the people that you hire from the schools and how you manage. Because in history, I see I graduated biochem, like, I don't know, back in 1998, and I wanted to go into this career because it was during the 1999 boom in the stock market, and I was like, you know what, forget about medicine for now. Maybe I could use what I've learned back then to try to analyze biotech companies. But I've learned
Yeah.
it's such a choppy thing, and maybe the market is starting to get there with the genomes being more interpretable. Um, so we might go into a phase where biotechs become like the next technology. You know, like the way Microsoft is $1 trillion company or whatever.
Yes, I totally agree.
It's the teams that matter. Like Tesla doesn't make money right now, but people are like, I'd rather just give him the money right
Yep, totally agree.
now. You know,
Absolutely. And we believe the same thing. Team is everything. I mean, it's great if a team actually has an incredible platform under it and huge markets to address and all that, but something's bound to go wrong. I mean, it's just, you know, we're doing company creation in biotech. It's hard. So as long as you've got the right people around it, so you can flag things very early before they get out of control and course correct and learn from those mistakes so you never make them again. That's all you can ask. And so I think that's why we've been focused so much on team.
so you guys have your scientists already. I mean, I remember ALNY was part of Boston, which I guess and that's like a hub of biotech, kind of.
Yeah.
You get people from MIT, this, that, you know. And then the company never really hadn't made a drug yet. Just like you said, preclinical to clinical just brings you up this much in market cap, and then first phase, second phase, you know, you get,
Yeah.
you know. So this, I mean, are you guys, because a lot of biotech companies that I speak to, this one's different. I'm not saying you guys are like that. It's just they have this one drug that they bought, and they just try to promote it, and then hopefully the FDA will approve. You know.
Yeah. I would never invest in one of those. I call those one-hit wonders.
Yeah.
I mean, I mean, I'll take that back. I mean, I think there are some one-hit wonders that you could probably make safe bets on, but they're such binary events, and so that's why I like a portfolio-based approach just in life, right? And so if as a company they've got a based approach with some data that says that they can get it to work, like animal data showing you're curing animals left and right, which we do, then I think, that's a lot safer of a bet.
Beautiful. Yes. So that's good. And how did this come about? Like, what's the history behind this? Like, um, this method, this technique. Um, how old
Yeah.
is it? You know.
Yeah. Sam had a dream one night and thought the whole thing up. And I said, that's a great idea. No, I'm just kidding. It's the
No,
end of
I
a
know.
long
It's
way.
great.
But no, it's, my background is in, trying to sequence the genome and get an understanding of what causes all of these diseases at the genetic level, and then work to put the diagnostic infrastructure in place so patients could get access to it. And it was just, the time was right because I found this platform that had the potential to, in a scalable way, sort of reverse polarity and go turn those genes off. And it was just like, oh my gosh, this is like the culmination of my entire life. And so from day one, we decided that we had to be extremely careful about how we built it. And that's what led us to finance the company in this way. So we maintained control at the board level. We maintained equity for management so that we weren't just diluted out ad nauseum, and remain fully, incentivized. And our outlook on partnerships, this is the one. And so, yeah, it's just a joy every day to build on it.
And this is your first project in biotech, or have you done things in?
No, I've done a bunch before. So I've done like 14 companies as a founder or co-founder before, and
Mhm.
advised 12, and done a bunch of partnerships, and all of them had potential, and but none of them had this type of potential.
Right.
Um,
That's
so I
so
was
good.
just, yeah, yeah,
And so you mentioned that you guys have this structure, this nylon nucleotide type thing. Would that be the same thing like in RNAi, the process of the mRNA being clipped because there are natural proteins that degrade mRNA anyway. So those companies like RNAi Interface, which was RNAi back in the days, and ALNY, they basically use how the body uses to degrade mRNA anyway, because I guess it's sitting in the cytoplasm, and
yeah.
it just needs to
No, it's
degrade. Like, is that you guys have like a synthetic version of that? What is it? An siRNA protein? Is that what it is?
so exactly. So what you're describing is Alnylam's technology, and there are a couple of others that use this double-stranded RNA, RNAi, siRNA. There's a number of different names for it that dock with this cellular machinery called the RISC Argonaut complex. And basically, when that complex sees that double-stranded RNA, it kind of remembers it. And then as the cell makes that specific sequence again, it'll go grab it and degrade it. So that's one way of silencing misbehaving transcripts. Um, we use another method, which is our drug will actually it's a single strand of what looks like DNA or RNA, and we program in the sequence that's complementary to the RNA we want to inhibit, and our drug will find it, engage with it, and then block it from being translated by a ribosome into a protein.
Right. That's beautiful.
Yeah.
Um, so, I mean, I think you've said pretty much everything that I needed to know. Now I need to know, like, what was the date you guys said that it could potentially go from preclinical to clinical? Like, is that like a next year thing? I heard him say.
Yeah. We're looking at the end of next year.
And this stock is marching up right now. I mean, it looks kind of stable. It looks like a great trading stock. It doesn't look like it's sloppy and thin. Um, I have a main portfolio that I work at a hedge fund in, and I have a long-term account and I have a short-term account. So
Do
I
the
played
long
this on
term.
my short. Yeah, of course. I'm gonna have. I can't do size in my long term. That's the thing. I could do big size on the short term, but that's not what you guys are looking for anyway. But I would only put myself in a position hugely if I feel like there's going to be a run to the next level. But what's going on that it's going up right now? Is it just these presentations and people just being like, "Oh, I got to accumulate this," or is there something being expected? Um,
Man, if I could understand the stock market, I would be in a different business. Not necessarily. I'm joking. I don't know, Sam, if you have any perspective on
Yeah,
that.
I mean, I think it's probably two things. I think number one, Dietrich and I have, because of the method that we went public, we've been spending a lot of time out there introducing the story to the street, and I think we continue to pique the street's interest, both on the underlying technology, but also the valuation arbitrage. With other companies at similar preclinical stage with platforms that are not as broad, that are trading at 3, 4, 5x the valuation, with the only real difference between the two being maybe a little bit more data and some more purple haze, so to speak, just because of the way they went public. And the second thing is that we've messaged around the fourth quarter data set. So we're within the fourth quarter right now.
right.
So
Okay, I got you.
we think that next data set will probably be that that next leg in terms of building off of the data that we put out in March, which was transformational for us. So I think probably a combination of the two, and we continue to get out there heavily, talk to investors, and hopefully we're converting them as we move along.
Yeah.
So I currently own 15,000 shares in the long term.
Awesome.
But I'm looking. I mean, that's kind of enough. I could have made millions in this, but if I bought it in COVID. But I was so busy thinking that the world is over that I forgot to pick up some of the things that I really liked. But I didn't expect this massive bounce so quick. I mean,
Yeah, it's amazing. Well, we're not even close to done yet. I think as Sam has mentioned, the comparables, I mean, after this fourth quarter, the comps are billion-dollar market cap companies. After the next 12 months, the comps are $2 billion market cap companies. And that's just getting started, right? 2 billion versus Alnylam, Ionis, Moderna. So I don't know if that qualifies as short term, but we think this is going to be a cool period of growth for the company.
no, I like it. I like it. I like the pace. I'm going to be around. I'm going to listen to conference calls all the time.
Great.
I will also. I mean, let me just tell you a story. I was buying NVAX, mRNA when I learned about COVID
Ah,
the end of December. You know, And of course, I was short the market naturally because I thought the world was gonna hit a pause button for a while, and I made some good money shorting. But I bought a shitload of because I didn't know how to even invest in COVID, so I just did a search for COVID on press releases, and all I saw was NVAX, INO, Moderna, all these stocks. I was buying at $1, $1.50, $2 heavy. I'm like, the world's about to end. People are like, nah, it's just the flu. And the stocks were
wow.
not barely moving, barely in the midst of all of this nonsense. Like they were going up a little bit and then giving it up. And then, like I sold so much of them as soon as they started to
No.
finally go because I was like, fuck it, it's gonna come back now. And then they just exploded. I
Took
mean,
off. Oh my gosh.
Oh, man. I'll buy you a beer when we get together next time.
I could not believe it. Oh, and ALNY and RNAi, I was buying those heavy, and that's when I just began this industry, like on trading institutional money, not institutional, like proprietary trading money. So I was so heavy in these, and that's when I learned that biotech doesn't matter how good the vision is. There's just so many people involved that there's always buyers and sellers all over the
Yeah.
place. So you got to kind of either time the next level up in my business, which is usually around catalysts, like you mentioned. Um, but this, you can make so much money if you know what the hell you're doing in this business, or if you have pocket money like a rich dad sitting around where you're just like, let me just put in 2 million here, 5 million here,
Yeah.
and just wait, you know.
Yeah, exactly. Exactly. Exactly.
So And I've
Hey,
had
David.
massive home runs, but it's very hard to hold in hindsight. Like I remember Gilead when it was nothing, ALNY when it was nothing, and now they're
Yeah.
huge. CAR-T, Juno, Kite, like every
Yep.
single one. ARWR was something that almost put me out of business because it went from
Yeah.
40 back to 2, and now it's back to 45, and it's like the next best thing, you know? So it's
Yeah.
I
just
bought
so
Regeneron
difficult,
at
man.
$3. And I told everyone I knew to buy Regeneron at $3. And then I
Oh
told
my God.
sell it at 115. I was like, sell this thing. It is so overpriced.
Oh,
And then it went to 500. And now it's at like 600
yeah,
something.
so that actually Regeneron is an example of when you have a solid molecule, you just get the respect from the street. I mean,
Yeah.
Yeah. Hey guys, I'm
all
sorry I
right,
got another
no
call
problem.
right
It was
Yeah, we got
great.
John.
Thank you very much.
now. Yeah, likewise. Great to
Thank you,
talk to
man.
you. Let's
Absolutely.
stay in touch.
All
Okay,
right.
see ya.